Today's Talk365 TV's Talking Wellness is brought to you by Fairbanks Art of Plastic Surgery with wellness team expert Dr. Grant A. Fairbanks.
Hey everybody, I'm Holly Love and welcome to our Talking Wellness series. Today I am super excited to introduce you to our brand new wellness team expert, Dr. Grant A. Fairbanks. Hi, Dr. Fairbanks.
Good morning, Holly. How are you?
I am doing so good. We are beyond thrilled to have you join our team of wellness experts because I'm going to brag on you a little bit, so get ready.
Okay.
You are among the top doctors in this industry of plastic surgery. You have a huge list of accreditations, starting with being board certified by the American Board of Plastic Surgery, recognized by the American Board of Medical Specialties, past president of the Utah Plastic Surgery Society and the Salt Lake Surgical Society. Plus, you have affiliations with the American Society of Plastic Surgeons, the American Cleft Palate Craniofacial Association, the International Society for Auricular Reconstruction, and the Aesthetic Society. Then, in your spare time, you are an adjunct assistant professor of surgery at the University of Utah School of Medicine. And then every year, you teach a medical life drawing and sculpture course for the Aesthetic Society's national meeting. So basically what all of this points to is that over your 17 years in this industry, you have honed proven advanced surgical skills with artistic skill that results in both functionality and aesthetic beauty, but most importantly, natural looking results. And what is interesting to me is that it is this artistic skill that sets you apart as such a gifted and talented surgeon, and yet it is the artistic skill that is the thing that almost made you not a surgeon.
You're correct.
So you are a fourth generation Utah artist, and as a kid you were determined to follow in the footsteps of your grandpa and become an artist yourself. So before we dive in and talk too much about all of your specialties, I'd like to go back a little bit and tell me about your family and your journey, because your history in this community as well as in art is really, really interesting.
Well, I appreciate that, Holly. Growing up, I spent a lot of time with my grandfather. My grandfather was Avard Fairbanks and a prominent Utah artist. Is known for many of the mascots in high schools and at major universities here. It's like the BYU Cougar and the University of Utah Ute Indian behind the Union Building. He's known for multiple monuments around the state of Utah, as well as the nation. In particular, he's got some statues in the Statuary Hall at the U.S. Capitol. He's known for designing the initial Dodge Ram hood ornament for the car in 1932. In 1947, he returned back to Utah and started the College of Fine Arts at the University of Utah. And I was able to go to Italy with him and learned how to carve marble as a 12-year-old. So I wanted to be an artist like my grandfather. Later on, I spent some time in Italy during my college years. And at that time, I was doing some work where I was working with people, and I enjoyed doing that. And I thought, you know, I'm wondering if I should do something different than just being an artist. And my father is a plastic surgeon, and he's also an artist. In fact, he's responsible for the Eagle on Eagle Gate here in Salt Lake City. So I decided that I was going to be a pediatrician. So I came home and got back into school at the University of Utah, and I started with a technical writing class, and I chose ear reconstruction because my father was taking care of some children with ear deformities, and I was able to watch the surgeries. Once I saw the change in these children's lives, I decided that that's what I wanted to do.
That's awesome.
So between medical school and residency, I was in the Army as a general medical officer, eventually completed a plastic surgery residency. During that time, my plastic surgery rotation was in Hangzhou, China with Operation Smile, and that's when I was introduced to cleft lip and palates. There I learned that reconstructive surgery and cosmetic or aesthetic surgery are really one and the same.
Yeah.
The question is why are we doing the surgery? And that's what determines whether it's reconstructive or cosmetic. So that's how I became the plastic surgeon that I am today.
I love it. Besides ears and cleft palates, you have other surgeries you've specialized in as well, and facelifts are another area of expertise. So tell me about those, and again, a little bit more about your approach to plastic surgery that is very exclusive to you.
Well, facelift is an important procedure because it also changes lives. We've seen people who are feeling like they're looking more tired, feeling older, and yet they feel young. And that's what it drives many people to the facelift. And it's not just women, it's also men. Our approach to the surgery is to put things back where they used to be. I take the things that I learned in residency, and then in my practice, I take my artistic background, put them all together, and that's how I approach my surgery. I feel that it's important to understand the anatomy and to reproduce the anatomy and to make it functional if we need to. For example, our approach to the facelift is bring the cheeks up and give a nice neckline and have somebody look like they're 10 to 20 years younger, looking like themselves, but not looking like they've had an operation. And so that's what we do with the facelift. With other procedures, for example, are the eyes. We call it a Blepharoplasty, and that's where we take off the extra skin of the upper eyelids and of the lower eyelids. It will help the eyes look younger, but sometimes for people who've had a lot of extra skin, it helps them to see better.
Wow. So let's talk about ear pinning. As a kid, if you had ears that were out, how much being made fun of is something that's scarring, and how the procedure, it's very quick and easy to do, and it's something you specialize in.
Yes, I do. So these are the children that have been teased at school for what they call Dumbo ears or something like that. Girls get away with it more because they'll wear their hair down. The boys, if they're wearing their hair short, they don't get away with it as much. We do an incision from behind the ear, rearrange the cartilage, pull it back into a more aesthetic position. Heals up very nicely. I've had older patients come in who say, you know, my parents did braces for me, and that was great, but I wish they would have also helped me with my ears. Often these are the parents that are bringing in their children who have the prominent ears, saying, I don't want this to happen to my children like it happened to me.
Wow. I love the association with braces. I think empowering our next generation to just be strong and self-confident is one of the coolest things. I bet you have so much fun.
It's very satisfying.
So moving from ears, let's talk a little bit about rhinoplasty and revision rhinoplasty, because it's a different animal and it's a technique that requires a lot of skill and one that you have honed over your years in the industry.
Correct. Our approach to rhinoplasty is both anatomic and functional, and it's important to understand the anatomy, and it's important that a nose not only looks good, but breathes well. With a regular rhinoplasty, that is a primary rhinoplasty, no previous surgery, no injury, the anatomy is where it should be, but sometimes a little different, and then that's where we rearrange some of the cartilage and take down, say, the bump on the nose, and we'll also do the work on the inside to straighten the septum and open the airway. So again, the nose not only looks good, but breathes well. With secondary rhinoplasty, also known as revisionary surgery or revisionary rhinoplasty, this is a little more challenging. The anatomy isn't like you would expect. Often parts are missing, and that's where we have to think about whether or not we want to use cartilage from the ear. Sometimes we have to use cartilage from the ribs and reproduce all the anatomic parts of the nose.
Well, when I think about you over in Italy carving marble, and I think about how you bring that skill to carving cartilage to return a nose, however it got to its state from multiple breaks, accidents, born with deformities, or you just want it to look a certain way, understanding that that artistic skill is such a huge component to actually having a result with a functioning nose working the way you want it to.
You're correct.
Let's talk a little bit about fat grafting, because I know that's a piece of the facelift and other procedures that you use in the industry.
Correct. So fat grafting has been a wonderful technique. It's been evolving even more so over the last couple of decades. One of the beautiful things about fat is stem cells are associated with the fat cells, and they help with the quality of the tissues. So where do we use the fat in the face? I personally like to use it around the lips, acne scars or fine wrinkles in the forehead or between the eyebrows, and to fill in some divots or something from a trauma or some other defect. Either way, fat is a wonderful, wonderful thing to use as an alternative to the injectables. We've had a lot of very satisfied patients with fat grafting. Another procedure gaining more and more momentum is fat grafting for breast augmentation.
Oh, wow.
So often people will joke about taking it from somewhere and put it in their chest. And I tell people, no, we can actually do that. Of course, the limiting factor is how much fat can you donate.
Do you need donations from other people? Because I
Well,
could
it has
happily.
to be from the same person, sorry.
Dang it, I thought we could start
Everybody
a
likes
side
to
career.
No, it's the same person. Either way, we take it from the hips, we can take it from the belly, we can take it from the thighs, and if done well, they're soft and they look natural, they feel natural. And of course, then there's the breast augmentation with either saline or the saltwater implants, but the more popular are the silicone gel-filled implants.
Now, another one is tummy tucks. So there's a lot of good stuff that goes on with the tummy tuck. So let's talk about it.
Often people call this the nip and tuck, and it is a procedure where people think, oh, it's just cosmetic, when in fact it helps with the function. So what will happen is, with either childbirth or obesity, the rectus muscles, your six-pack muscles, they'll separate. We call that a diastasis. So when we do the tummy tuck approach, not only do we take away the extra skin and some of the stretch marks, we take those six-pack muscles and put them back together, and we can increase the core strength and sometimes improve back pain with that.
Wow. So not just moms, anybody who is unhappy with their stomach situation is able to receive some benefits from that, right?
Correct. The tummy tucks that we do for men, and tummy tuck is also known as abdominoplasty. These are typically men who've lost a lot of weight and have the excess skin that's hanging over. One of the other keys about a tummy tuck is not only having a good scar pretty well hidden, and also make a belly button look like a belly button, so that if we have a patient that likes to expose their belly for one reason or another, and if you have a scar around the belly button, that's a telltale sign.
Belly dancers, he's got you covered.
There you go.
Yeah.
The one thing we do is every procedure we do is individualized for the patient, and we approach it just for them, and we go over all the factors to include all the safety factors too.
Well, your consultation process is very unique because you implement your artistic approach as well as the medical in the consultation process, so that the presentation in the end for the patient, you really know what's going to happen and what you're going to get, and you have a visual on what the outcome may look like. So let's talk about your consultation. Let's talk about how you do things a little bit differently, because you are a surgeon that is also a gifted artist.
Well, I appreciate that, Holly. It's very kind of you. I like to treat people the way I'd like to be treated or have my family treated. So I want my patients to really understand what it is that we need to do for them. And I like to give them options. You mentioned the drawing. Yes, I do the drawing because I want them to understand what is going to happen and what to expect. And for me, to draw it out is just, to be honest with you, it's easier for me.
Yeah.
And so by the time we go to surgery, the patients understand what's going to happen.
If you want more information about Dr. Fairbanks and the procedures that he does, I would recommend logging onto their website, fairbanksmd.com, where you can watch an extended TV interview and online consultation where we went through each of these specialty procedures individually and really broke them down and talked about them at length. And for a limited time, you can also sign up and get a complimentary consultation in here with Dr. Fairbanks when you mention Talk365TV or enter promo code Talk365TV by booking it online, which is probably over $175 worth of a consultation fee, and you can get yours for free. Dr. Fairbanks, thank you so much for your time.
Thank you, Holly.
I am so excited to have you a part of the team. I can't wait for our next rounds of information to go out and our next time we get to sit down and chat.
Great, thank you.
All right, don't go anywhere. We will be right back on Talk365 TV right after this.